First at 10 tonight, a huge announcement from President Trump. His administration claims there is a link between acetaminophen, commonly known as Tylenol, and an increased risk of autism. He urged women not to take the drug during pregnancy. Now, the FDA will soon begin notifying doctors to warn pregnant patients about the risk. The president says the number of autism diagnoses has risen dramatically.
The meteoric rise in autism is among the most alarming public health developments in history. There's never been anything like this.
The president and his medical leaders came to this conclusion due in part from the opinion of Dr. Andrea Baccarelli. She is the dean of the Harvard University Medical School, who reviewed 46 worldwide human studies. She released a statement saying the association is strongest when acetaminophen is taken for 4 weeks or longer. But Drexel University professor Brian Lee, who co-authored the largest study on the topic, says there's no strong evidence to support this, and evidence points to other factors. He studied 2.5 million kids in Sweden for 20 years. Fox 13's Evyn Moon is in the newsroom for us tonight. Evan, I know some pediatricians are sounding the alarm, calling this claim misleading.
Hi there, Allie. Yeah, well, the president said 6 months ago that they would have answers on autism by September. And today they came forward and said acetaminophen is a big risk factor. Well, I spoke with a Tampa mother tonight who has an autistic son about the link.
And you shouldn't take it during the entire pregnancy.
The president announced the FDA will be warning physicians. They believe acetaminophen in Tylenol taken during pregnancy is associated with increased risk of autism for children.
They are strongly recommending that women limit Tylenol use during pregnancy unless medically necessary. That's, for instance, in cases of extremely high fever, that you feel you can't tough it out, you can't do it. I guess there's that.
Some physicians disagree with the research.
And they are grabbing straws. You know, there are some small links in smaller studies showing that Tylenol use can increase the risk of autism and ADHD. However, these studies didn't look at genetics, which we know is a huge factor for autism, family history, or other variables.
She says the benefits outweigh the risks.
Migraines, pain, fever, all of which the benefits of using Tylenol greatly outweigh any risk of anything.
I spoke with a mother of an autistic son. She couldn't remember if she took any Tylenol during pregnancy.
And now you're thinking on what are the causes and have to remember if you took Tylenol or not years ago, and if you did that have anything to do with the diagnosis? But I don't believe that that is the main answer. I mean, it could play into the cause of it, but I think there are many links, and I think they should also be considered.
She wants more research on other potential causes of autism, too.
It's just broad, and it shouldn't be limited right now to focus in on Tylenol, because my son was also born premature. That can play a big part into it.
The American College of OBGYNs also commented on Trump's announcement, saying in part, the data from numerous studies have shown that acetaminophen plays an important and safe role in the well-being of pregnant women. Acetaminophen has been considered the safest over-the-counter option for pain or fever for pregnant women. Other common pain relief options like ibuprofen or regular dose aspirin can increase the risk of serious complications during pregnancy, and not treating a fever can also be dangerous for both the fetus and the mother. The mother I spoke to says if moms can't take Tylenol, she does want another safe solution for pregnancy pain. Allie.